Hi, welcome to Akron Safe Pledge. I'm Andrew Harris. This is the educational class that's needed for Akron Safe Pledge program. Much of what we're going to present here today, I'm not sure will be entirely new, but I think that this will be a really good review. So let's get started. The COVID-19 pandemic has changed the way we live and the way we work. And there's no place where that's truer than in the restaurant and food service industry. Not every restaurant will operate in the same way. Different precautions may need to be taken depending on how the virus is spreading in your local area and on the emergence of new variants. But there are some basics that we all need to know. As a restaurant and food service industry employee or owner, you already know how to protect guests from foodborne illnesses. Protecting them from COVID-19 requires many of the same practices. Let's start by learning a little more about this virus and how it spreads. How the SARS-CoV-2 coronavirus that causes COVID-19 works is that it spreads from person to person. Anytime an infected person sneezes, coughs, talks, or laughs, they create respiratory droplets that can land in the noses and mouths of anyone nearby. Those droplets can also land on surfaces such as tables, menus, phones, just about anything. If a person touches a contaminated surface and then rubs their mouth, eyes, or nose, it can lead to infection. So what are the symptoms? Symptoms include fever or chills, cough, shortness of breath or difficulty breathing, muscle or body aches, fatigue, headache, nasal congestion or runny nose, sore throat, nausea, vomiting, diarrhea, and a new loss of taste or smell. Symptoms can appear anywhere from 2 to 14 days after exposure to the virus, but some infected people don't show symptoms at all. CDC recommends the most effective way to protect yourself from getting COVID-19 or becoming seriously ill is to get vaccinated and to get boosted when eligible. Your operation may strongly encourage, even require staff members to get vaccinated against COVID-19. I know here at the health department, we're required to be vaccinated. According to CDC study, people who had COVID-19 and did not get vaccinated are more than twice as likely to become reinfected as those who had COVID-19 but did get vaccinated. The virus spreads between people in close contact, so wearing a mask is another way to avoid both becoming infected and transmitting the virus. Not all infected people show symptoms, so it's best to always protect yourself as much as possible. Avoid touching your face with unwashed hands, especially your eyes, nose, and mouth. Wash your hands. Wash your hands, wash your hands. Mask. The main purpose of a mask is to keep yourself and the people around you safe by controlling the spread of droplets and particles released into the air. You want masks to fit snugly and comfortably against the sides of your face. Make sure that the mask covers both your mouth and your nose and that you can breathe without restriction. For the disposable masks, really the N95s are the best. They're the kind of the gold medal standard and are recommended. Cloth masks may also be worn. A washable cloth mask should be made of multiple layers of fabric. When you're putting the mask on, be careful not to touch your eyes, nose, or mouth with unwashed hands. If you do touch the mask, always treat it as if it's contaminated. Wash your hands. If you remove your mask, remember not to set it on a food contact surface. Either dispose of the mask or place it in a container or bag, and then put on a clean mask and launder the contaminated mask. It's strongly encouraged that people who have not received a COVID-19 vaccination always wear a mask. And remember that even if you are fully vaccinated, masks still add a layer of protection against the virus. To help protect you and your guests, operations should look for signs of illness during pre-work screenings and have specific health check questionnaires, policies in place. Most restaurants, when they were reopening at the very beginning of the pandemic were required to have a pre-check, pre-screen for your employees each day. Many of the facilities that we inspect still continue that practice. I think that's a good thing. Your operation may also have reporting requirements for those that have become infected with COVID. Keeping yourself healthy is the best way to keep your guests safe. We already know that getting vaccinated is one of the best ways to keep yourself healthy. But what if you aren't feeling well? The most important thing is to stay home if you're feeling sick. If you feel sick at work, tell your manager. You might be sent home. You may be asked to see a healthcare provider. COVID test kits are available from the local health department. We have them for free. They're also distributed, at least currently, free at the libraries. They're available from local retailers. You may be required to quarantine. Any areas of an operation that have been used by someone that's tested positive for COVID should be closed off until they can be properly cleaned and sanitized. If you have been in close contact with a person that's been diagnosed with COVID-19, let your manager know. Close contact is defined as within 6 feet of an infected person for a total of 15 minutes or more. While you may be permitted to continue working following potential exposure as long as you've remained asymptomatic, it's a best practice to get a COVID-19 test to confirm your status. So, being in the restaurant business, you already know how to wash your hands properly. CDC recommends 20 seconds of scrubbing. It's like singing the happy birthday song twice through. After washing, you don't want to recontaminate your hands or arms, so you may want to use a paper towel to turn off the faucet and to open the door when leaving the restroom. If hands have become contaminated and you're not near a sink, FDA recommends using a hand sanitizer that contains at least 60% alcohol, and then wash your hands properly as soon as possible. The operation should be routinely cleaned and sanitized. While dealing with coronavirus, there's one more term you'll hear a lot: disinfecting. Yep, sanitizing and disinfecting are not the same, and they may use different chemicals. Disinfectant should not be left on food contact surfaces. You'll need to rinse it off, then clean and sanitize the food contact surface according to FDA food code regulations. A lot of the bottles of product that you'll sometimes buy, even if they have a picture of a kitchen on there or they say they're for the kitchen, if you read the small print on that bottle, it'll specifically instruct you to rewash, rinse, and sanitize a food contact surface that product was used on. So just read the bottles for the products that you're using. What needs to be cleaned and sanitized? So we know that operations should be cleaned and sanitized regularly. But what does that really mean? What exactly do you need to clean and sanitize? Well, everything. Food contact surfaces, of course, but pretty much everything else as well. Basically, if an employee or a guest can touch it, then it needs to be cleaned and sanitized on an ongoing basis. Pay special attention to items that are touched frequently, such as light switches, handles and doorknobs, phones and touch screens. In the back of the house, surfaces need to be cleaned and sanitized more frequently. Same for the restrooms. In the front of the house, between seatings, it's important to clean and sanitize everything that can be touched. That includes items like salt shakers, check presenters, digital ordering devices, touch screens, tabletop seats, and please do not forget the menus. Social distancing. The way we work in our operations has also changed. We've all heard plenty about social distancing to keep us, our coworkers, and our guests safe. And that's important because we're sharing space with our coworkers in the back of the house and with our guests in the front of the house. Restaurant and food service operations look a little different. Outdoor dining options are common, and you're probably seeing signage. That includes signs at the entrance stating that no one with a fever or symptoms of COVID will be permitted inside the operation. The layout of the facility may change as well. Each operation is different, but reasonable distancing should be practiced where possible. Technology can help. Contactless payment systems and mobile ordering apps are effective ways to reduce close contact. Reservation systems and encouraging guests to call or text ahead can also help to reduce guest crowding in waiting areas and bar areas. Some operations may encourage guests to wait outside or in their cars until a table opens up or while a carry-out order is prepared. Because the virus is transmitted through the air, you should pay special attention to the operation's ventilation systems. This might include using air filtration systems or special filters, changing the filters more frequently, and opening windows, letting fresh air in whenever possible. Of course, our job is to provide great food and service. We deal with people during the course of our work. So, when working with guests, wear a mask to keep both of you safe. If your operation has hand sanitizer for guests, be sure to let them know where it is and thank them for their patience. Pickup and delivery both have gotten a lot more popular. The same tools used in the rest of the operation apply here. Using masks, maintaining social distancing, and preventing crowding and maintaining good hygiene. Use touchless payment systems if offered by your operation. Offer to place pickup orders at your guest vehicle or in your guest vehicle. Food packaging is critical. Whether the customer is picking up or receiving a delivery, the packaging is the barrier between the food and the potential contamination. That's why it's important that the packaging stays closed and intact. It should never be opened by anyone except the customer. When delivering food off-site, cleaning and sanitizing matters too. Coolers, insulated bags, even the delivery vehicle that all of this is carried in should be cleaned frequently. Reduce close contact just like everywhere else, and encourage customers to consider no-touch deliveries if offered by your operation. And that's it. We're ready to keep working, and now you know what to do. Keep everything clean and sanitized. Pay attention to hygiene, especially hands. Get vaccinated, get boosted, and wear a mask. If we do our part, we can help keep everyone safe, employees and guests. So what's next? Now that you've completed the online training course, you'll need to email Andrew Harris with Summit County Health Department at Harris, that's AHARRIS at schd.org, with your name, your facility's name, and please state that you've completed the online training. You will be sent a link to a letter of attestation, which you will need then to resubmit to us. That, if I'm not mistaken, is a Google form that when filled out and hit submit will come right back to us. Once we've received the attestation confirmation, you will be sent the COVID safety checklist and the certificate of completion. So here's the checklist. This is what this will look like. You'll need to fill this out and resubmit this. But this form, we've designed it in a way that beyond this program, if you'd like, you can use this form in your day-to-day operations. Here's the certificate of completion. You'll receive this, and obviously your name will be on it. So then what do we do? So once you've received the checklist and you've filled that out and completed that, you're going to log back into your submittable account. That's the account that you created for the pre-application that you submitted to the city of Akron, and you're going to upload the completed COVID safety checklist and the certificate of completion, both of which you're going to receive both of those after you've signed that letter of attestation that you completed the online training. So questions about the application. So once you've received the checklist and the certificate of completion. You've completed the checklist. You've logged back into Submittable, and you're going to upload those. If you have questions about that process or the application process, you will need to contact Dr. Joan Williams, and here's her contact information on the screen, but it's 330-375-2258, and her email there is jwilliams, so JWILLIAMS at Akron, AKRON, Ohio.gov, G-O-V. So jwilliams at akronohio.gov. And that's it. So thank you very much. Again, my name was Andrew Harris. There's my email address again if you missed that a few slides ago. And we appreciate you watching this. Again, thank you.